My name is Amy Tutor, and I'm an obstetrician-gynecologist, and I blog as The Skeptical OB at www.skepticalob.com. I've prepared this video to highlight a few things that many people just don't know about home birth midwifery. First of all, we should clarify what we're talking about. We're talking about home birth midwives, who were originally known as lay midwives, have also been known as direct entry midwives, and now have certifications such as Certified Professional Midwife, CPM, or Licensed Midwife, LM. There's some important things that most people don't know about home birth midwives. First of all, home birth midwives are not certified nurse midwives. The United States is the only country that has two classes of midwives. Regular midwives, in this country they're certified nurse midwives, and a second inferior class of midwife that exists nowhere else, known as certified professional midwives. Home birth midwives are not like European, Canadian, or Australian midwives. This is really important to keep in mind because often home birth midwives cite research from Europe, Canada, or Australia to promote home birth when the midwives in those countries are very different than American home birth midwives. American home birth midwives have less education than any midwives in the industrialized world. In contrast to midwives everywhere else who have university degrees or even master's degrees, home birth midwives can become home birth midwives without any education at all. There are some states that require no educational credentials to practice. There are other states that require the CPM, but the CPM can be obtained just by a program of unmonitored self-study at home. In fact, in one of the most prominent studies of home birth midwives, the Johnson and Davis 2005 study published in the British Medical Journal, the vast majority of midwives in that study had never attended midwifery school, but had gotten their certification by self-study. American home birth midwives also have less training than any midwives anywhere else in the industrialized world. All other midwives, whether they're certified nurse midwives in the United States, Australian midwives, Canadian midwives, midwives in the Netherlands, the UK, or anywhere else in Europe, have hospital-based training as well as home birth training. American home birth midwives, including those who have the CPM certification, have no hospital-based training. So what are the differences between certified nurse midwives and certified professional midwives? In the table you can see that I've compared certified nurse midwives and certified professional midwives, but as the asterisk indicates, European, Canadian, and Australian midwives are very similar to certified midwives. The first difference is the level of education. Certified nurse midwives have a master's level degree, which makes them the most educated midwives in the industrialized world. Certified professional midwives have only a post-high school certificate. In fact, until September of 2012, a high school degree was not a requirement to become a certified professional midwife. Certified nurse midwives have taken college courses in science and statistics, which enables them to read and understand at least some of the scientific literature. Certified professional midwives not only don't have to take college courses in science or statistics, but they don't even have to go to college. Certified nurse midwives have extensive in-hospital experience. That's where they get most of their practical training. That allows them to gain experience in recognizing, preventing, and managing complications. In contrast, American home birth midwives, including those who have the Certified Professional Midwife credential, have no hospital experience. So most of them have never seen the complications that they may have to deal with in their practice. Certified nurse midwives have extensive training in diagnosing and managing complications. Certified professional midwives, who like to call themselves experts in normal birth, actually have no experience in diagnosing and managing complications. The fact is, no one needs an expert in normal birth. It's almost like being a meteorologist who's an expert in good weather. We don't need any meteorologists when we have good weather. We want to know what's coming and how to prepare for it. People who only understand normal birth and have only seen normal birth are not in a position to recognize complications at the stage where they're early enough to be managed without harm to baby or mother. Certified nurse midwives almost always have immediate access to hospital facilities and obstetrician backup. That's because they're legal in all 50 states, and most have in place relationships with obstetricians and relationships with hospitals. In contrast, homebirth midwives, including those with the CPM credential, generally lack any relationship with hospital facilities or obstetrician backup. That means if they manage to recognize a complication, or after a complication has happened, their only recourse is to head to the emergency room, where no one is expecting the patient and no one is prepared. Most people don't realize that American home birth midwives are not eligible for licensure in any other country, in contrast to certified nurse midwives. American home birth midwives are not eligible and would not be eligible for licensure in the United Kingdom because they lack the education and training required for midwives there. They are not eligible for licensing in the Netherlands for the same reason. They don't have the level of education and training that is expected in the Netherlands. They're not eligible in Canada either. The certified professional midwife credential used to be recognized in Canada, but a number of years ago it was abolished because it was felt that certified professional midwives and other lay midwives lack the education and training that's necessary to provide safe care to babies and mothers. Similarly, American home birth midwives are not eligible for licensure in Australia. In fact, they're not eligible in any other first world country. That's something important to keep in mind when home birth midwives complain that they're not licensed. We're not talking in that case about midwives being licensed because real midwives, certified nurse midwives, are licensed in all 50 states. We're talking about licensing a second inferior class of midwife with less education and training than any other midwives in the industrialized world. And we're talking about licensing midwives who would never be considered for licensure in any other first world country. Contrary to the claims of American home birth advocates, all the existing evidence shows that American home birth is unsafe. In fact, most of the existing research shows that planned home birth has a neonatal death rate at least triple, 3 times, that of low-risk hospital birth. The most recent CDC statistics show that planned home birth increases the neonatal death rate by more than 600%. Even the studies that claim to show that home birth is safe, for example, the Johnson & Davis BMJ 2005 study, actually show that home birth with a CPM has tripled the rate of neonatal mortality of low-risk hospital birth in the same year. Why is it that the Johnson & Davis study has such a different conclusion than what the data actually show? The reason is because the Johnson & Davis study is a bait and switch. If you read the study carefully, you'll see that Johnson & Davis compared the intervention rates of home birth with a CPM in 2000 against the intervention rates of low-risk hospital birth in the year 2000. However, when it came time to compare the neonatal death rate, they did not compare births in the same year. Instead, they compared home birth with a CPM to a bunch of out-of-date studies extending back to 1969. That was the only way that they could show that home birth was comparable to hospital birth. Unfortunately, they neglected to mention a piece of information that was publicly available. The neonatal death rate for low-risk birth in the hospital in 2000 was a great deal lower. They simply left that out of the paper, hoping that no one would notice the bait and switch. Why might they have done that? Well, one thing that they failed to disclose is that Ken Johnson is the former director of research for the Midwives Alliance of North America, the group that represents American home birth midwives. And Betty Ann Davis, his wife, is a home birth midwife. They did disclose in their paper that the funding came from a home birth midwifery foundation. As I mentioned before, the CDC data show that home birth has an increased risk of neonatal death. And here you can see the actual results of the CDC data for 2007. Keep in mind that these are planned home births. Unplanned home births are not included here. We're looking at the results from white women, 37 plus weeks, with babies of 2,500 grams or more, and the mother's ages are between 20 and 45. Why are we looking at this specific group? Unfortunately, race is a risk factor, and almost all women in the United States who have home births are white. Therefore, the correct comparison group is white women. We're only looking at women who delivered at term, who has babies of normal size, and were neither very young or very old, both age groups having a higher rate of complications. So in this chart, we're comparing like with like. You'll notice that the mortality rate for low-risk hospital birth with a certified nurse midwife is 0.34 per thousand. In contrast, with a non-nurse midwife, referred to in this chart as a direct entry midwife, the death rate is 2.62 per thousand. That's more than 7 times higher. You may notice that the death rate for MD attended birth is 0.57. Does that mean that obstetricians have poorer results? No, it doesn't. Certified nurse midwives, by training and scope of practice, only care for women who are low to moderate risk. Therefore, all the high-risk patients are in the MD group. That includes women with pre-existing medical conditions and a variety of complications of pregnancy. So it's not surprising that the MD result has a higher mortality rate than CNM. The other important factor is that the way the CDC has been tracking the data, if the mother starts off attempting a home birth but is transferred to the hospital before the baby is born, the birth ends up in the doctor category. So that means that mothers who are transferred to the hospital who subsequently give birth to a baby who dies within the first 28 days will be counted in the MD group and not the home birth group where they really belong. Therefore, this chart, as appalling as it is, actually undercounts how dangerous American home birth is. It's not just the CDC data. There are very few states in which they collect data for home births, but in those that do, all of them have death rates much higher than comparable risk hospital birth. A perfect example is the state of Colorado. Colorado has licensed home birth midwives since 2006, and they've made a condition of their licensing that they must release their death rates every year. You can see that the perinatal death rate, located on the right-hand side of the chart, is high and rising, and really has risen to appalling levels. We're looking here at the perinatal death rate, not the neonatal death rate, so that we would expect the rate to be higher. Perinatal deaths or neonatal deaths plus late stillbirths. The overall rate for the entire state of Colorado, of all gestational ages, all pregnancy complications, all races of mothers, is approximately 4 per thousand. The home birth death rate for presumably low-risk women has in every year exceeded the death rate for all risk women in Colorado. And not only has it exceeded the death rate, but it's been rising. Between 2006 and 2009, the death rate rose from 6.13 per thousand to 7.56 per thousand to 11.3 per thousand. At that point, Colorado home birth midwives stopped releasing their death rates. Fortunately, we were able to obtain access to the raw data submitted by Colorado home birth midwives by filing a Colorado open record request. And it's not surprising why Colorado home birth midwives tried to hide their 2010 and 2011 death rates. The death rates were even higher still. In fact, in 2010, the death rate for low-risk women having a home birth in Colorado was 4 times higher than the death rate in the hospital, including women of all risk levels and all gestational ages. In fact, home birth in Colorado is the most dangerous form of planned birth. As I mentioned before, the home birth death rate is rising. Home birth advocates like to point to the Netherlands and like to claim that the Netherlands, with the highest home birth rate in the industrialized world, has excellent outcomes. Unfortunately, that's not even close to being true. The Netherlands has one of the highest perinatal mortality rates in Western Europe. The Netherlands has the highest home birth rate in the industrialized world. It's currently in the range of 27% and falling. It has the second highest perinatal mortality rate in Western Europe. Now you'll see home birth advocates quote studies about the Netherlands which show that Dutch home birth neonatal mortality rates are comparable to those in low-risk hospital births performed by Dutch midwives. But it turns out, much to everyone's surprise and dismay, that low-risk hospital birth with a midwife in the Netherlands, whether at home or in the hospital, has a higher mortality rate than high-risk birth with an obstetrician in a hospital. That's actually a very appalling statistic. The chance of your baby dying in the Netherlands is much higher if you have a midwife-attended birth, whether at home or in the hospital, than if you have an obstetrician-attended birth. Now, what about the home birth midwives in the United States? Are they releasing their own death rates? Well, they're collecting them, but they actually refuse to release them. The Midwives Alliance of North America represents home birth midwives. They've amassed a database of about 27,000 home births that have occurred since 2001. And each of these home births have addressed safety issues in a series of 360 separate questions on each birth. The Midwives Alliance of North America has publicly offered the data, but you can only receive the data if you are vetted and receive approval from the Midwives Alliance of North America. As far as I know, no one outside the organization has received approval to obtain that data. You also must sign a legal non-disclosure agreement. If they share the data with you, you can't reveal the death rates to the public. The refusal to disclose these death rates is a huge red flag. MANA has released safety data on all other aspects of these home births. They've released intervention rates, transfer rates, and C-section rates, and in fact have bragged about how low those rates are. The most important thing you need to know is the death rate, and that they won't say. You don't have to be a rocket scientist to suspect that the death rates at home birth attended by American home birth midwives are appalling. Otherwise, the Midwives Alliance of North America would release the death rates and would be trumpeting them. The most important thing about medical decision-making is having the information to make an informed decision. You can't be informed about home birth if you don't understand that American home birth midwives have less education and less training than any midwives in the industrialized world, that they are not eligible for licensure in any other country, that all the data collected on the results of home births attended by American home birth midwives show much higher death rates, ranging from 3 to 7 times higher than comparable risk hospital birth. And you also should be aware that the Midwives Alliance of North America is hiding their own death rates, and that can't be a good sign. If home birth with a home birth midwife was safe, the Midwives Alliance of North America would reveal their death rates. The fact that they don't indicates that even the Midwives Alliance of North America knows that home birth with an American home birth midwife increases the risk of newborn death. They just don't want you to find out. For more information, you can visit my website, www.skepticalob.com.